Hi, good evening, friends. This is your neurologist, Dr. Manish Mahajan, consultant neurologist from Gurgaon. So, continuing with the discussion on multiple sclerosis, first of all, I would like to uh, say that because of the professional commitments, I was not able to put up this video in the morning. So, I'm creating this evening after a long day at work, and another break in the trend that I'll not be discussing the disease modifying therapies today, though I'll be rather shifting my gear to one of the requests which has been very well made by one of my follow-up person with multiple sclerosis, to first talk about some epidemiology of multiple sclerosis. That is, what is the prevalence, what are the causes, what are the risk factors, slightly in detail. So, coming back to the bite about the multiple sclerosis. So, if we talk about it, multiple sclerosis is a chronic disorder, so the prevalence is more than the incidence. As per a very latest report in 2020, the World Atlas of Disorders, it has been estimated that around 2.8 million people worldwide are currently affected with multiple sclerosis. And it is the second most common cause of disability in young people after trauma. So that makes it pertinent to discuss about the disorder. So the other thing which we need to understand, that there is definitely geographical variation in the prevalence of and incidence of this disorder. Obviously, it has got some reporting bias, where obviously the robust reporting system of the Western Hemisphere has contributed to the literature and the knowledge about multiple sclerosis. So more cases are reported from West as from the East, and so definitely this has led to lower reporting incidence in the multiple sclerosis in Indian subcontinent especially. But if we talk about India, we have some close to 4 to 10 per 100,000 people, which have been the prevalence which has been estimated in Indian studies, predominantly from Mumbai and from the east, from Kolkata. Now, and some studies have been performed in Chennai as well. So this is all about the prevalence. If we come about the causes of multiple sclerosis, so there are various hypotheses, but no particular cause has been found that what triggers multiple sclerosis. A very recent hypothesis which is being studied in detail, and few of the therapies are also being considered and revolving around that concept, is the role of Epstein-Barr virus. That's a particularly a virus which causes infectious mononucleosis in young people. So this is being studied and is being hypothesized to be one of the triggers for multiple sclerosis. Now, this causation, a single cause has not been established, but there are definitely some risk factors for developing multiple sclerosis. The most common, I would say, non-modifiable one, definitely the multiple sclerosis is much more common. One of the videos I have talked about it, much more common in females, to the tune of 3:1, that 3 times the females are more likely to get this disorder than males. It's a disease of young, the RRMS variant. Most common age group affected, where the onset of the disease happens between the age group of 20 to 40 years, but we have patients from 5 years of age to more than 50, around 50 also. But the primary progressive MS has got some 10 years later onset, so more common in elderly people. But I have already mentioned that other differential, one of the videos on differential diagnosis, I've mentioned it, that other disorders which can mimic both clinically as well as radiologically must be considered when we are trying to make a diagnosis of multiple sclerosis in elderly people. So similar is the case with kids, where other disorders like MOG associated diseases and EDEM make precedence. Now, the other risk factors, other than staying in Western Hemisphere, are called a lower latitude, that means closer to the poles, and the other one is the vitamin D deficiency, which has been not only implicated along with smoking as a risk factor for multiple sclerosis, but also risk factor for the I would say the relapses. So low sunlight exposure, indirectly contributing to vitamin D deficiency, can also be one of the risk factors. So it's a complex interplay of the genetics and environment. There are certain genes which, like what we call as haplotypes, which are make you more susceptible to have the disease. But if you have that particular haplotype, that doesn't mean that you will have the disease. Obviously, a first degree relative and nothing more than concordant twin, so identical twin, if he or she is affected with multiple sclerosis, that makes you more vulnerable to this disorder. The first degree relative, like your parents, like your siblings, then your risk is to the tune of 3 to 6 times more than the general population. That is about the risk factors. There are different haplotypes or different genes which are being studied, but no particular gene has been found out to be causing the multiple sclerosis, and inheriting definitely that gene will make you have that expressing the multiple sclerosis as a disorder. And current knowledge states that someone who's genetically predisposed gets exposed to some unknown trigger, the inflammation or the swelling in your brain, spinal cord or optic nerve, and that's how the whole cascade start. So we today discussed about that it's prevalent throughout the world, and what's more important is that it's the secondly most common cause of disability in young people. That's what makes this discussion very important, and the awareness about this disorder, very important one. I would like to highlight that earlier in India it was thought that this disorder doesn't exist at all, which has been now completely proven wrong. We do have multiple sclerosis, and we do have Indian population getting affected with this disorder, and with more and more availability of and obviously the awareness among not only the public at large but also the medical fraternity, more and more people are getting diagnosed with multiple sclerosis and are getting benefit, I would say, out of the available disease modifying therapy, which would be the topic of discussion for the next talk tomorrow. So I hope this covers the epidemiology, and please don't forget to put your comments and put your queries. I'll definitely try to prepare a video on any of the questions you want, and I will try to answer them as simply as possible. Goodbye till then, and for now, uh, and I will definitely reiterate, my health, my responsibility, and I don't want I didn't want to miss this today's walk, so I am continuing with the 7th day of the HDR 100-day walk run challenge, and hope to complete it 100% with all your wishes, and wishing all of you all the health and very healthy life ahead. So good night.